In health, I learned about food-borne diseases, which are caused by eating food or drinking water that is contaminated by microbes or pathogens. One of the most common of these is diarrhea. When you have diarrhea, you'll experience loose, watery, and frequent bowel movement. You may also feel pain in your abdomen, nausea, and vomiting. This could be caused by bacteria, viruses, or parasites. Cholera is caused by Vibrio serogroup O1 or O139. It's a type of bacteria found in places with poor sanitation, unclean drinking water, or inadequate hygiene. It spreads when people eat food or drink water that is contaminated by the poop of a person with cholera. What's worse about this is the fact that cholera may sometimes occur without symptoms, but in severe cases, it can cause diarrhea, vomiting, dehydration, leg cramps, or even death. Similarly, typhoid fever is also caused by bacteria, and it is spread in places with poor sanitation and unclean drinking water. It is caused by the bacteria Salmonella typhi. This can cause a person to have high fever, head and body aches, tiredness, cough, and constipation. But in more severe cases, it can cause diarrhea and even death. Amoebiasis is an illness in the intestine caused by a parasitic amoeba called Entamoeba histolytica. A person with amoebiasis may not feel anything, but it can cause him or her to have stomach pain, diarrhea, weight loss, fever, and an infected liver. Eating expired food can cause food poisoning because an expired food may contain large amounts of harmful bacteria, which may cause you to have fever, diarrhea, and vomiting. Make sure to check the label of the food before consuming them. Hepatitis A is a foodborne disease caused by a virus of the same name. The virus can be found in the poop and blood of an infected person and can spread through personal contact by eating contaminated food or drink. When a person has hepatitis A, he could feel long days or even weeks of fatigue, nausea, stomach pain, and jaundice. However, hepatitis A can be prevented by getting vaccinated. Have you noticed that most foodborne diseases are spread by eating food or drinking water that is contaminated by the poop of an infected person? The pathogen that causes diseases thrives in areas with poor sanitation, hygiene, and dirty drinking water. So, always keep your surroundings clean, and it is best to avoid going to places with poor sanitation if you can. But if it is unavoidable, always be careful of the food and water that you consume. Bye!